Botox, and Blanca just had a little peel, but what we're going to do is raise your eyebrows, and we're going to help soften these lines and make a mean face, and we're going to help soften these lines here. Smile, big smile. And these here, we're going to inject around here to soften these lines. And basically what Botox does is that it helps soften the lines by minimizing the movement of the muscles. Botox is a purified protein. When absorbed by the muscles, prevents the muscles from moving. Consequently, you'll get a more relaxed facial expression. You won't get those heavy lines. Some patients report that they look angry or mean, and injecting in between the eyebrows here will soften this appearance. And that's what we're going to do. Botox only lasts, it lasts anywhere between 3 to 5 months, on average about 3 months. It can take up to about a week before you get the full effect. I like to advise my patients, obviously of the risks of Botox. All medical procedures have, risks, and every time we inject there always is a little risk of a little bruising or bleeding under the skin. That is always possible. There are always blood vessels, especially around the eye here, that we try to avoid. But in some cases it does happen, and some patients can report little shiners that can last up to about a week. But these are things that you need to be aware of. Okay. Any other questions you have?
I trust you because I know you, but someone that's never had it done before, what is the main hesitation of what's out there in the media that you can enlighten people of?
Well, I think, one of the things is you want to make sure that you have a reputable physician injecting your Botox. Make sure that they are board certified, that this is their specialty, and that they do this. There have been instances in the past where people have gotten the wrong type of Botox or an illegal Botox, and in order to save a dime, they're using something cheaper.
Isn't it like some watered down? Some are watered down?
Well, right now I'm talking about something that was, illegal.
Oh.
Okay. But, we obtain our Botox directly from the manufacturer called Allergan, and it's the only type we use. The Botox comes in a box like this, and this is the official Allergan Botox. You can tell that, there is a little hieroglyphics here that you can tell that it is an official, Botox. That you can actually see the Allergan label there. It's kind of hard, you won't see it on the camera, but you can tell that it is an official vial from Allergan, the company. And it comes actually as a powder. So all Botox has to be diluted or quote-unquote watered down. Now the question that you're asking is, well, what's the difference between one office versus another? Okay, and yeah, there can be differences in the amount of Botox that is injected. To compare apples to apples, when you're getting Botox, it's all based on units. Okay, Botox is 100 units. Okay, that it comes in, and I can put, for example, our standard is we put 2.5 mLs of saline in here to dilute it so that we can inject it. And then based on that concentration, we have a syringe here which has the Botox in it, okay? And for every, I don't know if you can see this, for every 0.1 millimeter or milliliter of fluid, that is the equivalent of 4 units of Botox, okay? Now, in some practices, they may dilute this with 10 mLs, okay, at which point that this is a weaker concentration. So what you really want to make sure is that you're getting, whatever you're paying for, you're getting X number of units for it. Okay, we usually compare, dollars per unit, all right? So, watered down, that's kind of a little bit misleading in the sense that everybody has to dilute the Botox.
Okay.
It just depends how much they dilute it.
Yeah,
okay?
well, that was good clarity because that's something that's come out in the media before, and I wasn't sure about that. That's the only thing.
Yeah,
I know you're reputable.
It doesn't honestly.
But I know you.
Yeah.
But then someone that's never had it done before.
Honestly, it doesn't matter whether if I dilute it with 2 cc's and somebody else dilutes it with 5 cc's, as long as you're getting the same number of units. Okay, but in order to, for example, if I'm going to inject 40 units on you right now, and somebody dilutes it twice as much, in order for them to give you the same amount of units, they have to give you twice the volume. And sometimes more volume can be bad because the volume can spread to other areas, especially in the glabella. If you're injecting too much volume here, it can spread and potentially cause problems with eyelid drooping.
Right.
So there is kind of a balance and a trade-off.
That's a good point. Yeah.
Yeah.
That's a very good point.
But you know what people sometimes say is, well, how much Botox do you get? And I say, well, I've had one syringe before. Well, one syringe could be, in this case, it's 40 units. In other cases, if it's diluted twice as much, it could be 20 units. In some cases, it could be 10 units. Or in other cases, it could be, you know, even more. So it just really depends on the concentration that the doctor is using when you talk about per syringe.
Okay.
Okay. Or per area. Sometimes doctors charge per area. Well, it's, you know, X dollars for this, X dollars for that, and X dollars for that. What you really need to know is, well, how many units are you getting in that area for that value? Okay.
All right. So how many units am I getting?
Well, we've got about 40 units right now. We got 1 ml, and our concentration is 4 units per every 0.1. So 4 times 10 is 40 units.
Okay.
I think that's a fairly good average. I think that's what we've done with you.